How does overactive bladder cause frequent night urination? Have you ever wondered why some people find themselves waking up multiple times at night to use the bathroom? This common issue can often be linked to a condition known as overactive bladder. Overactive bladder, or OAB, causes frequent night urination primarily by increasing the urgency and frequency of bladder contractions. These contractions reduce the bladder's capacity to hold urine during sleep, leading to a symptom called nocturia. Under normal circumstances, the bladder stores urine until it reaches a comfortable volume. This volume signals the brain when it's time to void. However, in individuals with overactive bladder, the bladder muscle, known as the detrusor, contracts involuntarily and suddenly. This can happen even when the bladder isn't full, creating a strong and urgent need to urinate. As a result, the bladder's functional capacity is reduced, meaning it cannot hold as much urine overnight. This leads to waking multiple times during the night to urinate. There are additional factors that can influence nocturia in people with overactive bladder. One of these is reduced nocturnal bladder capacity. The bladder's ability to store urine at night is decreased due to overactivity, which leads to more frequent trips to the bathroom. Another factor is increased urine production at night, a condition known as nocturnal polyuria. While this is a separate mechanism from overactive bladder, some patients may experience both conditions, which can further increase the frequency of night urination. Nocturnal polyuria involves producing an excessive volume of urine at night, which can overwhelm even a normally functioning bladder. Sleep disruption also plays a role. The urgency caused by overactive bladder can fragment sleep, making individuals more aware of bladder sensations. This increased awareness can lead to a higher likelihood of waking up to urinate. From the perspective of bladder health, frequent nocturnal urination due to overactive bladder is a common symptom that can significantly affect quality of life. It is important to note that while nocturia is a symptom of overactive bladder, it is not itself a sign of bladder cancer. However, if you notice any new or worsening urinary symptoms, especially if accompanied by blood in the urine or pain, it is crucial to consult a healthcare professional. This can help rule out more serious conditions, including bladder cancer. In summary, overactive bladder causes frequent night urination by triggering involuntary bladder contractions that reduce storage capacity and create urgent, repeated needs to void during sleep. Managing overactive bladder symptoms through behavioral changes, pelvic floor exercises, and medical treatments can help reduce nocturia and improve overall bladder health. If you are experiencing these symptoms, consider reaching out to a healthcare provider for personalized advice and treatment options.